My name is Regina. I'm the teacher of Pathophysiology. During 6 years, students study only in English. So teachers, they are able to speak English during semester. So you should pass 3 colloquiums to get access for examination. FEFU also have hospital, FEFU medical center. Yes, I always try to explain very complicated things in pathophysiology to my students in a funny manner. Pathophysiology communicate with other disciplines, so students, they study pharmacology, they study surgery, pathanatomy, and pathophysiology helps.
Hello everyone, welcome to our special interview session. Today we are honored to have with us a senior faculty of Far Eastern Federal University of Pathophysiology Department, Miss Regina Leonidovna. So today we are excited to gain insights directly from her. So ma'am, can you introduce yourself?
My name is Regina. I'm the teacher of pathophysiology in Federal University. I have been here for 5 years. And I'm also the doctor. I work in the regional cardiovascular center in the regional hospital number 1 on Aliutskaya.
Okay, ma'am. So to begin with, could you please give us an overview of Far Eastern Federal University and its general medicine program? What is its reputation of general medicine program of Far Eastern Federal University?
So still, we have 2 medical universities in our Primorsky Krai, but FEFU, I think he has a good reputation, because instead of getting the School of Medicine, the FEFU also have the hospital, FEFU medical center, so students who get the knowledge here, they can directly practice and fix their knowledges, in their different departments of the medical center. Also, FEFU is good in case not to study medicine only, but others areas, and FEFU takes more foreign students, and the area of FEFU is much bigger, so I can say that FEFU is a rather good university, and it's considered to be one of the good university in Russia.
Okay, thank you so much, ma'am. So, ma'am, many students and parents are often concerned about the medium of instructions or language of instruction. So, could you please clarify in what language the general medicine program in Far Eastern Federal University taught in? Like in which language?
So educational program here is taught in English only. So during 6 years, students study only in English. So teachers, they are able to speak English. So all of us have the certification. Maybe some of us have diplomas of English knowledge. So your classes, your lectures, your exams, all are provided in English.
Okay, ma'am. Thank you, ma'am. So, ma'am, as you are a senior faculty of Pathophysiology and you are teaching here in Far Eastern Federal University Pathophysiology to Indian students from a very long time. So, could you please tell us the significance of Pathophysiology in the general medicine program, or which is known as MBBS?
Okay, so pathophysiology is a very interesting and very important topic for the future clinical practice, because on our classes we study etiology, pathogenesis of disease, clinical manifestation, so different mechanisms how disease developing. And when you become doctors, you will deal with such disease. You will check the syndromes, will try to understand what happened. You will check the laboratory values. You will try to interpret different instrumental signs also that will help you to set the diagnosis. But also you should administer the treatment. But treatment can be administered only if you understand the etiology and pathogenesis of disease. So that's why I'm very strict in teaching my students pathophysiology.
So basically, ma'am, you are working here in Far Eastern Federal University as a faculty. So could you please tell us what is the general impression of Indian students towards their learning? How are they in studies? What is their general impression toward the studies, toward the learning, the things? If you can explain it.
Okay, so actually for me, because if you talk about third year, Yeah, so I still think that my students, they are children that require strict approach. Yeah, so I actually make them to study to learn. I'm trying to explain them that pathophysiology is very important. Yeah, and most of the students, they understand me and they try to learn, study, so they put efforts. Yeah, of course, we have some small percentages of students who still they don't know what they want to be, and they don't know actually what they want to do. Yeah, but still most of the students, they accept my approach and learn pathophysiology.
Okay, thank you, ma'am. Ma'am, basically, how does the teaching structure works in FEFU, in Far Eastern Federal University? How does the teaching structure work here? Like how the practical classes and lecture, how the things work here?
Mm-hmm. So classes, yeah, provided for the groups. Yeah, groups are separate. Yeah, around 15 students each group. Yeah, so we have different teachers. So it doesn't mean that one teacher will teach pathophysiology to all groups. No. Yeah, there are around 9-10 groups in each year, and lectures, they are provided for whole course. Yeah, in one time. For example, on Tuesday, yeah, so pathophysiology lecture, yeah, so all course join the lecture, yeah, but classes, they will be provided in different days.
Okay, ma'am. Also, ma'am, can you please give us an overview of like how the exam conducted in Far Eastern Federal University?
Mm-hmm. So, no, frankly speaking, I can say about my subject, yeah, so during semester, yeah, so you should pass 3 colloquiums to get access for examination. Yeah, so we provide them around 5 classes, yeah, then colloquium 1, then again 5 classes colloquium 2, and again 5 classes colloquium 3. Each colloquium includes some topics, like 4 or 5 topics on different topics, like it be inflammation, immune topic, hypoxia, etc. So if student pass the colloquiums, he or she get the access for the final examination. So students have tickets, examinations taken in vival form. Ticket include 3 questions, can properly prepare to the exam.
Okay, ma'am. So, ma'am, moving to our next question, how do you make pathophysiology more engaging or more interesting for the international students?
Actually, first of all, I'm a teacher who like pathophysiology, and I put a lot of efforts to make my subject much interesting. First of all, I always try to explain very complicated things in pathophysiology to my students in a funny manner. Yeah, giving the examples of real life. Yeah, for fixing this in the memory. And later, when they pass me the colloquiums, they usually remember these things. Yeah, because they were funny, interesting, and coming from the real life. Second, I always explain topics. So I don't ask my students to study by themselves, yeah, and I always open for the questions, yeah, so they ask a lot of questions and I always answer on them. So also I don't put attention who you are. You're a Russian student or African student or Indian student, doesn't matter. You're a student who would like to study medicine. I will always help you to do this.
Okay, ma'am. Can you please provide us an overview of pathophysiology subject, like how the curriculum of pathophysiology works here?
So yeah, we have 2 semesters in year. And the first semester we study general pathophysiology, including typical pathological processes like hypoxia, inflammation, immune system, neoplasia, peripheral blood disorders, yeah, reactivity and resistance, etc. Second semester we study organ and the system of organs. Yeah, so we study pathophysiology of RBC disorders, WBC disorders, platelets, cardiovascular system, respiratory system, etc. So this helps students to go deeper in the problem. Yeah, like specific disorders. Yeah, not only general processes, and also pathophysiology communicate with other disciplines. So students, they study pharmacology, they study surgery, yeah, path anatomy, and pathophysiology helps to provide the overview of the disorders combined with other disciplines.
So thank you so much, ma'am, for your valuable information, and thank you so much to joining us.
Thank you.
Thank you.
Ivan.